Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe.
And I'm Dr. Shazma Mithani.
And a special thank you to our episode sponsor, Figs. So obviously in our line of work, you live in your scrubs. And if you follow us on Instagram, you probably already know this by now, but we're obsessed with Figs. They're super comfortable, breathable, durable, and they actually fit, which is just a huge upgrade from the horrible itchy scrubs that were the status quo for so long. They're also just super cute and stylish. You feel good wearing them.
Absolutely. Like Sheila said, we are obsessed. But you know what I love the most about Figs? They just get what it's like to work in this field. It's not just that they know what we need, like 7 pants pockets to carry all my stuff around during shift. They also built this incredibly supportive community of people who want to have important discussions and make real connections with people who work in healthcare. I've been to a couple of their events and they've done such a good job. It's so refreshing as a brand for them to show up in such a real way. And you guys, if you're not following them on social media, their memes, they are absolutely hilarious and so relatable. So good. So if you work in the healthcare field or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, so that's FIGSCA, you can get 20% off your first order. That's wearfigs.com. Use the code FIGSCA.
So today we're going to be talking about one of the most common and very anxiety-provoking reasons parents will bring their kids to the emergency room, Shaz, to see you or to see me in my family practice office. And we have a wonderful listener question up here from Cecilia.
Hi, my kiddo is about 8 months old and they've had their first fever. And I know that's pretty normal, but I'm also really nervous about fevers in general. And it's my first time as a new parent. Any advice you would have would be really helpful. Thanks.
This is so relevant, Shaz. I think our kids are just getting over their own fevers this past week, and it's one of the most common things that people come in to see us for. So thank you for sending us this question because I think many parents are feeling this right now, given the season that we're in. So let's start really simple. Like, what is a fever and how do we measure it? And a fever is generally defined as when the body temperature is 38 degrees Celsius, which is around 100.4 degrees Fahrenheit, or higher. And that's the threshold that most guidelines will use. But it's really important to note, how do you actually measure the temperature?
Yeah, so that is a really important point because a lot of times my experience as an ER doctor, and I'm sure your experience in the family medicine office as well, is that parents will come in and a lot of times, like, the temperature that we measure in the emerge is very different from what they're getting at home. And so it's important for parents to know that the gold standard in children is a rectal temperature, especially for kids under the age of 2 years old. So for me in the emerge, anytime a baby comes in, like an infant comes in, I don't believe any temperature other than a rectal temperature. And that's particularly important. We'll talk about this kind of later in the episode, but particularly important in young babies because a fever is something that we take really seriously. Oral and tympanic, so ear temperatures, can be accurate in older kids. Oral is ideal. So as soon as your kid is old enough to hold a thermometer in their mouth, that is the next best thing compared to a rectal thermometer. Tympanic ones or the ear ones are kind of not as accurate. Another place you can put them is the armpit. The armpit tends to overestimate a little bit as well. And so ideally, if not a rectal thermometer, then a mouth thermometer. The one thing that I actually want all parents to throw away are those like infrared, they don't touch your forehead ones, like the ones that just like shoot at the forehead. Those are useless. Those actually like can be affected by things like light glare and a kind of ambient temperature and all these other things. And they just really, we know that those aren't accurate. And so those I really recommend not using at all.
And if you have a rectal thermometer, just make sure that you distinguish it from your oral thermometer, because if you have different aged kids, that's a really important point that I always clarify for families to do. These are great points because I think a lot of parents come in, Shaz, and they'll say, my child feels really warm. And that's hard to actually predict. Is it actually a fever or not? So I always emphasize if it's possible to have a thermometer, that's a really important tool to have in your medicine kit if you have little ones around.
And that just for anyone who like has a friend that has a newborn or is pregnant, that is a great gift. Getting them a good, accurate thermometer.
Every baby shower list.
Absolutely. Okay, so let's talk about why fevers happen, because I think there's a lot of misunderstanding and potential confusion here, because fever is not actually an illness itself. It is a response, the body's immune response to something that's causing the fever, typically an infection. And so when the body detects that infection, there are chemicals that start being activated called pyrogens. It's a fancy name for chemicals that cause the temperature to go up, or chemicals that cause a fever. And they actually signal part of the brain to raise that set body temperature.
Yeah. And what's important about this is that this higher temperature actually helps your immune system and it helps your immune system work better and it slows down the growth of bacteria and viruses. So instead of seeing it as something alarming, it's actually your body is working very well. It's defending itself and it's not something dangerous in itself.
Exactly. That's such an important point. That's something that I always tell parents when they come in to see me in the ER is that fever is actually a good thing. It's the body's way of helping to fight off that infection. It's not something in and of itself that we need to worry about.
Yeah, and this is so important, right? Like, again, I also talk to my parents and my family in my practice as well. And this is where, fever itself is not harmful. It doesn't cause brain damage or seizures. Febrile seizures can happen in some kids, but they're triggered by the sudden rise in temperature, not the actual number itself on the thermometer, and they don't cause long-term harm.
And parents, it's a good point because parents sometimes want to kind of normalize every fever, but remember the fever is actually telling us that the immune system is doing its job. You mentioned febrile seizures. We're not actually going to get into that topic today because it's an entire topic in and of itself. So be sure to listen to our episode 2 weeks from now. So our next episode, which is going to be specifically on the topic of febrile seizures.
Yeah. So stay tuned to that. So one of the things that I know myself as a parent, when I was a new parent, kids go to daycare and our little one would get recurrent fevers. And I also had the question, like, why is my child always getting a fever? Mm-hmm. And that's a big question we also get in the office and in the Emerge, as I'm sure that, the truth is that the kids, their immune systems are developing. And as they're developing, they're encountering new viruses and bacteria, and they are germ buckets, right? We've said this before. We've said it repeatedly.
That should be the motto of our show. Kids are germ buckets.
Right? So they're in close contact. They're putting everything in their mouth. They do not have the best hand hygiene. So they're having a lot more exposures than we do as adults. And it means that there's more illnesses as a result, and your body's defense mechanisms are going to kick in more frequently, resulting in more fevers.
And they're also encountering viruses that they haven't seen before, whereas we as adults have encountered a lot of these viruses and illnesses and have some level of immunity to them, so aren't going to react as strongly. I always like to remind parents when I see them as well is that we as adults rarely get fevers, and we often forget how awful they feel. Like, I can go years without having a fever, and then I'm very quickly reminded of how awful they feel if I happen to get one with an illness that I have. And kids, it really makes me have a lot more empathy for my kids in terms of like how well they manage having fevers, because it reminds me every few years when I get one just how awful they feel.
Oh yeah, they don't feel great at all. It's important to note, like we're really defining that fevers are a normal part of your body's immune response. They're not always harmful, but there are some specific situations in which we do actually want to see your kids and make sure that nothing else more serious is going on. So while most fevers are harmless, there are specific groups where we do take fevers more seriously. And specifically, those are in babies who are under 3 months of age because they're at higher risk for serious infections and their immune systems are not as strong yet. So any fever in that age group should be checked out by a doctor.
And the same goes for any child or adult really who is immunocompromised. So whether that's from chemotherapy, a chronic illness, or any medications that suppress the immune system, that is also a fever we take seriously. And that is not, again, because of the fever itself. Similarly, in babies under 3 months old, it's more what the fever might signify. Because they can't mount the same immune responses against a potential infection, the fever could end up signaling something more significant because it could signal that they have a severe infection because of their underlying condition.
And I love that you mentioned adults too, who are immunocompromised, Shaz, because certainly in our practice, and you see this in the Emerge all the time, that if you are immunocompromised as an adult due to medications you're taking or medical conditions, a fever is really a warning sign in that situation and an important thing to get checked out. So while we are focusing on kids in this episode, adults who get fevers, especially in the context of being immunocompromised, should also get checked out. Another really important thing that we always consider when we're assessing somebody who has a fever, it's to understand what their immunization status is. So in the past, before routine vaccinations would be happening for things like Haemophilus influenza, Streptococcus pneumonia, serious bacterial illnesses like meningitis and epiglottitis, which is the swelling in the neck, were much more common causes of fever, which we virtually do not see anymore because of immunization.
So in a child whose immunizations are up to date, the likelihood of the fever being caused by some sort of a life-threatening infection like meningitis, epiglottitis, is significantly lower. And we often can take a more measured approach to their workup. We may not even have to do blood work. We can just do an exam, look at them, observe them, make sure they're drinking well, and kind of reassure the parents, because we are we know that they are immunized against these potentially life-threatening diseases and are not going to have those. But we are seeing a lot more of this now. And anyone who is under-immunized or unimmunized, our threshold to investigate is much, much lower. We think a lot more readily about blood work, urine cultures, maybe even a spinal tap, because these infections that vaccines prevent can be very invasive bacterial illnesses that can be extremely life-threatening, and we need to be able to diagnose them and treat them right away.
Yeah, and it's a really important reminder that vaccines don't just prevent disease, they also reduce the number of invasive tests and hospital admissions that kids might otherwise need when they get a fever. So really important to consider updating your immunization status, making sure you're up to date, especially as we head into this season.
Okay, so let's shift in terms of like giving some practical points on what parents can do for fevers at home, either if their kids get them or even if, on the rare occasion they get them as well. The most important question that I always get is, do you need to treat a fever? The short answer is not always. So what I always say to parents is that we usually treat the child, not the fever. And so if a fever is making your child uncomfortable, if they're more clingy, if they seem more tired, if they're not drinking or they're really not acting themselves, you absolutely should treat the fever. But if your kid has a fever, if you have a fever, you're feeling great, running around, doing your usual thing, there's no need to treat it because, as we said at the start of the episode, the fever is actually helping your body fight that infection off. And so it's okay to let the fever ride if you're feeling well, not just treat the number.
Absolutely. So the goal is comfort, really, and not normal, not getting that temperature down to normal, so to speak. So there are really great options for this. The common ones are things that you can get over the counter, like acetaminophen, which is also known as Tylenol, or ibuprofen, or Advil or Motrin. These are really common medications that you can use. And this really depends on the age, and the dosing is on the package, but you can also just make sure, just knowing that your kid's weight is really helpful to dose this appropriately. And if you're in doubt, just ask the pharmacist and they can help you out. No ibuprofen is given for kids under the age of 6 months, and no aspirin to any kid because of the risk of something called Ray's syndrome.
And don't forget about non-medication measures as well. So treating the fever is important to help for comfort, like you said, Sheila. But there are other things that can help your child feel better as well. So keeping them hydrated with lots of fluids. So fevers can actually cause further dehydration. So making sure they're drinking lots of fluids, dressing them lightly, so not too bundled, and then just letting them rest. Listen to your child. If they say they're feeling tired, if they want to just lay low, let them just have a chill day, manage their symptoms, keep them hydrated, keep them feeling comfortable.
We should add screen time to this part.
Yes.
Non-medication measures, like give all the screen time at this point, because
all
this
the
is what they
Bluey,
need.
whatever you want to watch.
Whatever it is you want to watch.
Just watch it. Yeah,
this is a comfort measure.
I completely agree. We have no limits on screen time when our kids are sick. We just let them,
oh my gosh,
be
we
comfortable.
They need it.
Have their little water cup in the basement, wrapped in their little stuff, with their stuffy close by, and just watching TV. I think it's actually therapeutic, personally.
I think so too. And parents, when you're managing kids who are unwell, likelihood is that you've also been exposed to the same things that they're battling, and you may not have the overt symptoms that they're having, but you also need a little bit of rest too. So don't give yourself some grace, and that screen time is fine. So let's switch gears and talk about, when should you come in to see your doctor or healthcare provider if your child is having a fever?
So Sheila, I'm so glad you brought this up, because this is something that I tell my parents at discharge every time I send a child home, because it's important for them to know the reasons to come back to the ER. And so not only are there reasons to come back, but if you notice this in your child, it's a reason to go in. So we talked about this already, but any fever in a child that is under the age of 3 months old or is immunocompromised or unimmunized, if your child has had a fever for more than 4 or 5 days, that's an important reason to be seen as well. Some symptoms to look out for as well: if there's any trouble breathing, a stiff neck, any chest pain, a severe headache, persistent vomiting, or a rash, you should come in. And then if your child is unusually sleepy, kind of really difficult to wake up, irritable, which means you can't really settle them down or console them, or they're not drinking fluids well or refusing fluids, those are reasons to come in too.
Yeah, this is such an important list to keep in mind. And of course, I always tell my parents in my practice, anytime your gut tells you something is off, your kids. If something doesn't feel right, trust your gut. And it's so worth getting checked out. We always would rather err on the side of caution. So if your kid is febrile, has a fever, they're unwell in any way, and they're just not themselves, and you're worried, call us or come in to see us, because that is what we're there for, to help make sure there's nothing else more serious going on.
Yeah, I'm so glad that you mentioned that, because this is also something that I always tell parents, is that if, all that list of things, but if something doesn't feel right, please come in. We are always happy to see you and reassure you, or check things out if we need to. So listen to your gut.
Okay, so time for a quick fever myth-busting quiz. So 1, true or false, all fevers are dangerous?
This is false. So fevers are actually a normal, helpful immune response. They, in and of themselves, are not dangerous. True or false, you must always give medications for a fever.
So false. Only if your child is uncomfortable. You don't need to treat that number. We're treating our child in front of us. True or false? Any fever in a baby under 3 months of age should be checked by a doctor.
That is true. So that is absolutely a red flag for fever. Any baby under the age of 3 months old with any fever at all needs to be seen by a doctor. True or false? Febrile seizures can cause brain damage.
False. They're frightening, but not harmful in the long term. And please do take a listen to our febrile seizure episode that's coming out in a couple of weeks to learn more.
Okay, so we always end with a prescription for our listeners, and here's our prescription for you today. Please remember that a fever is your child's immune system at work, not an illness itself. It is not dangerous. It is important to measure the temperature accurately, ideally a rectal thermometer or an oral thermometer in older kids, and focus more on how your child is looking and acting, not just reading the number. And lastly, treat the fever only if your child is uncomfortable, and always seek medical advice if they're under 3 months old, immunocompromised, or showing any of those red flag symptoms that we talked about.
And above all, trust your instincts as a parent. We also wanted to add something here about the top 3 things to know about fever in kids for healthcare workers. So we always want to emphasize for those who are listening who may be medical learners or in practice, these are the 3 things that Shaz and I keep in our back pocket when it comes to fever. So any fever under 3 months of age equals an automatic workup. Always check immunization status because it can change our threshold for serious bacterial infection and how much we need to work somebody up. And third, we treat fever for comfort, not the number. So that's really good guidance to give your patients just to keep that in mind. Otherwise, we tend to then overtreat sometimes.
And a reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And please be sure to follow us on social media at the Doc Talk Pod and send us your questions.